Oh, wait. There you go. Okay, now you can start.
Greetings from San Francisco. Welcome everyone to our first ever Community Action Model webinar. My name is Derek Smith, and I'm the director of the Tobacco-Free Project at the San Francisco Department of Public Health. We are excited for everyone to join us today to learn about the Community Action Model, or CAM for short. CAM has successfully been used to build community leaders for health and affect lasting change in communities like San Francisco. This model has been used for more than 20 years to drive policy, system, and environmental solutions to promote health in San Francisco and globally. We hope that this framework can help guide your work either in community leadership development, community organizing, or health promotion programs. During this webinar, please feel free to type questions into the chat box, and we will answer them at the end of the presentation during our question and answer session. If you should have any technical difficulties during the webinar, please note them in the chat box, and our attendant, Marina, will reply to you. The webinar is being recorded and will be posted on our website for later viewing. During this webinar, we will be answering 3 crucial questions. 1, why we use the Community Action Model for improving the health and well-being of our communities. 2, we will give an overview of what the 5 steps of CAM are by using a project example to illustrate. And 3, how the CAM program is structured at the San Francisco Department of Public Health, in which critical roles and resources are required for CAM implementation. We have 3 expert panelists who will be presenting on the Community Action Model today. First, Susanna Hennessy-Lavery, who is a part of the original team that developed the Community Action Model in the mid-90s, and the program has been providing technical leadership and technical assistance to CAM partners for more than 20 years. Ali Hu Win, who currently oversees the Community Action Model program for the Tobacco-Free Project at the Department of Public Health. She leads and coordinates trainings for CAM community partners and provides assistance so they can be successful in their work. And finally, our special guest, Itzel Estrada, who is from the Youth Leadership Institute. She's 20 years old and is a student at San Francisco State University. Currently, Itzel is studying sociology with a minor in Latinx studies and hopes to pursue a career in education policy. She joined Youth Leadership Institute back in 2015 and has been fighting health injustices since then as a part of the Youth Leadership Institute CAM team. Before we jump right into the webinar content, we're going to conduct a poll. Does everyone see the poll? On your screen, we're asking the question, what is your main reason for participating in this webinar? We'll take just about 15 seconds now, and we'd ask that each of you respond. What is your main reason for taking the webinar? All right, it looks like a lot of folks are listening in on the webinar today because their local health department really would like a model like CAM to support community development, and many others are from local organizations in San Francisco that may apply for upcoming Community Action Model funding. Great. So next up, my colleague Ali is going to talk about why we use the Community Action Model. Following, Susanna will give an overview of the 5 steps of CAM.
Great, thanks Derek. Well, here in San Francisco, we use the CAM model to address community health issues because we want to equip community members with the skills to drive effective change. The goal of the Community Action Model is to train and build capacity of emerging community leaders to change policies, systems, and environments to improve health. In San Francisco, we define emerging community leaders as youth and adult residents who are committed to engage and receive training and support to implement the 5 steps of the CAM to address a specific health issue. We partner and fund community organizations to recruit and train about 6 to 8 emerging community leaders each. At the end of the 5 steps, these leaders learn a lot about public health and its connection to social justice, how to conduct research like an interview or a survey to inform and educate their decision makers about their issue, and other key skills to drive community change, because they actually did those things over the course of their project. So instead of San Francisco Department of Public Health staff deciding how we want to address a health issue, such as not enough access to healthy foods in a neighborhood, we partner with an organization in that neighborhood to train and equip residents to understand the issue, identify, and win a solution at a policy, system, environmental level. We do so for 2 reasons. One, because we know that community organizations and members are the experts on how an issue impacts their community and what solutions will actually work. And because the more community members acquire the skills to drive change, the more that they gain power and voice to change the policy, systems, and environments that influence their health and well-being. So I've thrown around the term policies, system, environmental change, and I just want to spend some time to make sure that we all know what PSE means. So a policy is usually a written statement that describes an organization or public agency's position or decision. This typically is a law or a rule. For example, a policy change would be creating a law that says all streets in San Francisco must have a bike lane so that San Franciscans can have a safe designated lane to bike anywhere in the city. So that would be a policy. A system change is a changing organization procedure, like how much money is spent or how many people work on an issue. For example, a system change would be creating a new department within a public agency with the money and resources to make sure that all streets in San Francisco have a bike lane. All right, last one, an environment change is an observable physical change, like actually adding in those bike lanes to all the streets, or a social norm change, like all bikers in San Francisco riding in those bike lanes instead of the sidewalk. So that's what policy, system, and environmental change are. Now, the community action model focuses on training emerging community leaders to drive policy, system, environmental change, because this type of change promotes health at a community and population level. Public health programs and projects often focus on individual behavior change. For example, a nutrition workshop can educate attendees on how to eat healthy, but it isn't aimed at getting the whole community or population to eat healthy. This leads us to the second reason why we focus on policy, system, environmental change, because it's sustainable and long-term. Direct service, health education, or one-time projects usually has short-term impact, and it usually lasts the short term. The solution, and thirdly, the solution that the community action models leaders come up with will last beyond their project and continue to promote the health and well-being of their community, because it's a permanent change in policy or how an organization does something or in the physical and social environment. And lastly, policy, system, environmental changes address the root causes of health. Historically, policy, system, environments have been designed and implemented intentionally or unintentionally in a way that creates less opportunity for communities of color and low-income folks to attain health and well-being. CAM provides a 5-step process that gives power to emerging community leaders to create a policy, system, environmental level change that can improve their health rather than make it difficult for the communities to live healthy lives. So here's our next poll question. Which one of these is a policy, system, and environmental change?
We're going to give a few more seconds for everybody to get their vote in, and we're going to close the poll in about 10 more seconds.
Great. So it looks like about 80% of us voted, and half of us say implement. I can't see. I have to see. Sorry about that, guys. We're having a hard time viewing our own poll results. All right, so about half of us voted that an organization implements a wellness policy for snacks and waters at meetings, and that's correct. So this is a policy that's written in an organization and makes lasting change. Good job, you guys. All right, so I just want to recap again. The goal of the community action model is to build the capacity of emerging community leaders. Here's a great photo of one of our community emerging leaders orientations in 2015. And the reason why we build the capacity is so that they have the skills and experiences to create policy and system environmental change to improve health. And here's a photo of the Vietnamese Youth Development Center young adults talking to the media about their idea of creating a healthy corner store program that encouraged stores to sell affordable housing options, and this later became a city ordinance. All right, now that we know why we use the CAM, let's talk about how the CAM is implemented. Again, the community action model is a 5-step process that takes about 2 years. The CAM model can be used to train emerging community leaders to address any community issue at a policy, system, environmental level. At the San Francisco Department of Public Health, we typically fund a few community organizations to recruit and train about 6 to 8 emerging community leaders each and address health issues like tobacco and healthy eating. We provide technical assistance and support to all the organizations throughout the 5 steps. So step 1 of the CAM is to train participants, name the issue, and choose an area of focus. This typically takes about 3 to 6 months. So again, the first step of this CAM is to recruit and train about 6 to 8 emerging community leaders. The training aspect of step 1 is really weaved throughout the 5 steps, ensure that the leaders receive the training they need to continue their CAM project. We as the health department, in partnership with the community organization, provide a series of trainings that cover a range of topics, from social determinants of health to message development and media advocacy. Trainings are held in large groups, small workshops on specific topics, and even one-on-one. Our community organizations also provide training like professional development and other related social justice topic issues and other skills that complement their team's work. When CAM leaders complete their CAM projects, they acquire the skills and experiences to become community health leaders, and they can translate what they learn to other issues they're working on, their schoolwork, and into their future careers. The second part of step 1 is naming the issue. One of the first trainings we do is to facilitate a discussion on critically analyzing what impacts community health, drilling down to the root causes. In the public health world, we call this social determinants of health. So for example, we ask, why is there so much heart disease in a specific neighborhood? Someone might mention that people aren't eating healthy. Then we would ask, why is that? And someone might say that there isn't enough fresh and cheap healthy food in their neighborhood. It's just easier and cheaper to buy junk food or fast food. And then we would follow up and ask, why is that? Then we would have a group discussion about why larger grocery stores don't usually open up in low-income urban neighborhoods, but more so in wealthier neighborhoods. Oftentimes, our community leaders will find that policies and systems of discrimination have shaped the health of their communities. Naming the root causes of health like poverty, racism, and education inequality makes the health issue relevant to our camp leaders. Most of our camp leaders come from communities of color or low-income neighborhoods of San Francisco and experience these realities on a day-to-day basis. Connecting the dots and making health a social justice issue sets the foundation and drives the future work in CAM. All right, so now I'm going to hand off the mic to Anastasia, our YLI staff, and our CAM youth leader, Itzel, to share a little bit more about their organization, their CAM project, and their reflections.
Hi everyone, thanks Allie. This is Anastasia. I'm one of the program coordinators here at Youth Leadership Institute, also known as YLI. YLI as an organization focuses on partnering with young people specifically on leadership development, research, and campaigns. And one of the programs that we run here in the San Francisco office is the Community Action Model program, which is really a group of youth advocates who are leading the policy systems and environmental change that they want to see in their communities. The current campaign that CAM advocates are working on focuses on reducing storefront signage and advertising to 15% and showcasing cultural art instead. With that, I'm going to pass it to our advocate, Itzel, to share reflections and learning.
Hello everyone, my name is Itzel. I am a third year at San Francisco State, and this is my second year with YLI CAM. And the reason why I joined YLI CAM to begin with was because I'm originally from Southern California. I moved over here to go to school, and I wanted to build community with the city that I lived in, which was San Francisco. And so I decided to join CAM back in 2015, and ever since then I've been learning so much about systemic racism, health determinants, and social injustices. For me, throughout the entire campaign, what stood out to me the most was when we conducted a survey within the Mission District of San Francisco, and we surveyed about I want to say 200 community members, and after analyzing their opinions and creating data, we found that community members were likely to find a liquor store within 3 blocks of their home. And at that moment, I realized that this was an issue that was at the systemic level, and I realized that it would take the community to fight for healthy stores in our neighborhoods. And I would just say overall, CAM has helped me develop a critical lens of the community that I live in, my role in the community that I live in, and how I can help. And I've also learned that I love policy work, and that has also shaped my career aspirations. And CAM has also given me the confidence to know that I do have the power to create some sort of change throughout my lifetime, and that my voice does have a say, and I do have the power to raise it, and when I do, people will listen to me. And also just getting to know the way that government works and how policy is passed and how many times it takes to draft it and how many people you need to get in order to support you. And overall, speaking with like community members, stakeholders, and public officials has definitely developed my understanding of health equity in San Francisco.
Great, thanks, Itzel. I also want to give a shout out to Erika Cespedes, who has been working with the CAM group as well, and has was on the project before I came on and has taught me a lot. And with that, Allie, we can pass it back to you.
Thank you, Wildlife, for sharing about your experience. And it's how we hope to see you running for local office sometime, I guess, with your interest in policy work. And thank you for just the inspiring work that your whole team has been doing over the last 2 years. So we're going to talk about the last part of step 1. And this is where a CAM project chooses a focus area for specific health issues that they want to address in their community. So to help us walk through the rest of the CAM 5-step process, I'm going to pass it on to Susanna, and she will be talking about a past project from Youth Leadership Institute. Their past project was called TURF, or Tobacco Use Reduction Force.
Great. Thank you, Allie, and thank you, Itzel, and the whole YLI team. That was amazing. So, as Allie mentioned, I'm going to talk about the rest of the 5 steps of the CAM using this example from TURF. And as Allie mentioned, they went through step 1, and the last part is choosing their focus area. So their focus area was to look at the overconcentration of places selling tobacco with permits in San Francisco neighborhoods, especially in those neighborhoods with more low-income residents, communities of color, and youth, and that the high exposure to youth to places that sell tobacco is associated to higher smoking rates and other tobacco harms. So now that this team of emerging community leaders and the project coordinator have completed step 1, they move on to step 2, and that's where they define, design, and do a community diagnosis. So in other words, they choose their research questions about their focus area, they come up with their own research tools and design, and then they actually go out and do the research. And this can take 6 months, and we at the Department of Public Health and evaluators work closely with them along the way to help in this process. So let's go back to the TURF example. Here's what the emerging community leaders and the project coordinator did for their research. They looked to see if there were already existing policies or laws addressing their issue. They did a literature review and searched to see if any other cities or counties in the country had similar policies. They researched the local policymakers and the stakeholders, and they did their own primary research. In other words, they designed and did their own research. So they did neighborhood walking tours, they did surveys of the public on this idea of limiting tobacco permits, they interviewed government agencies, and they interviewed the corner store owners and others to get their opinions about this issue. Finally, they worked with us in the Department of Public Health and with the tax collector, and they collected data on tobacco permits. So how many were there in San Francisco, where are they located, et cetera, et cetera. So now that they have completed step 2, which is doing their research, they move on to step 3. And that's where they analyze the results of their community diagnosis, which is what they found out, and they pick their top 5 to 10 startling statistics or findings. So this is really the step where we say the light bulb goes on. In fact, it's what Itzel just referred to when she did the survey. And this can take 3 months, sorry. Again, we work closely with the project coordinator and with the emerging community leaders where they might learn to use SurveyMonkey to plan out their mapping, et cetera, and then use these findings to help the emerging community leaders further define the issue, educate the stakeholders and the media, and help move on to the next step. So here's the 5 startling statistics or key findings that the TURF team found from their research. They found that the overconcentration of places selling tobacco was more of an issue for low-income communities and communities of color than other wealthier neighborhoods. They found that the majority of schools in San Francisco have places selling tobacco within a couple of blocks. They found that places that sell tobacco actually make the majority of their profits from other products. They also found that there was an existing city program called Healthy Retail SF that helps corner stores shift their business model from depending on tobacco and alcohol and soda and things like that to selling healthy and fresh foods like produce. And then finally, they found that most of the residents they talked to supported their goal. So just to put a little more detail on this, they got the data from the health department to plot the tobacco permits, and you can see all of the purple dots on this map, and that there's a high concentration of stores selling tobacco in the Tenderloin, the South of Market, and Chinatown neighborhoods, as well as Bayview and the Mission. So this is important because these are the communities where low-income people and people of color and lots of youth live. They also went on to compare by supervisorial district the number of places that sell tobacco with the median household income. And as you can see in the pink areas, those same districts that had the lowest median household income also have the most stores or other places that sell tobacco. So for example, if you look at the first row, which is District 6, the South of Market and Tenderloin, there's 180 places with permits to sell tobacco, and the median household income is $37,000, which is very low for San Francisco. If you go down the list to District 2, which is the Marina, they have only 56 permits selling tobacco and have triple the median household income up to about $105,000. So this is a huge equity issue and disparities issue. Finally, they found that leaders in the Bayview Hunters Point, this was considered tobacco to be more of an issue than other leaders in the city, and that their community survey showed that over 88% of the people they talked to supported a policy limiting tobacco products in San Francisco. Okay, so to recap, this group of emerging community leaders and the project coordinator, they went through step 1, they went through the training, the naming the issue, and they chose their area of focus. Then they moved on to step 2, where they defined, designed, and did their community diagnosis or research. They then went on to step 3, where they analyzed the results of their community diagnosis or their research and came up with their startling statistics. And now they're moving on to step 4. And this is really the heart of the model. This is where, based on their startling statistics, the emerging community leaders and project coordinator choose their policy, system, or environmental change outcome that Ali defined early on. We call this an action, and as you can see in the middle of the circle, the action is defined by 3 criteria. It has to be achievable, so it has to be something that this smaller group of people, 6 to 8 community leaders and a project coordinator with our help, can accomplish. Second, it has to be long-term or sustainable. So even in 2 years, when this group moves on to work on another issue, whatever they have accomplished continues on. And thirdly, it has to compel another entity, some group that has power, like the Board of Supervisors, the City Council, the Board of Directors of a place of worship, an editorial board, anything like that, to do something to change the environment, the place people live, for the well-being of all. And once they've chosen this action, which is really the outcome of all 5 steps, it's their ultimate goal, they come up with a plan of educational activities to achieve it and then implement their plan. And this can take 6 to 8 months. So again, in step 4, they pick their ultimate goal outcome, which is their policy, systems change, or environmental change. And here's what the TURF team decided to do for their action. They chose a policy, a San Francisco policy, that would limit the number of places that can sell tobacco products per district to 45. So put a cap of 45 on all districts. Second, they wanted a policy that would no longer allow places to sell tobacco 500 feet from a school or 500 feet from another place that sells tobacco. And third, they wanted a policy that would no longer allow any more bars and restaurants to sell tobacco. So that was their ultimate goal. That was the outcome of the whole 5 steps. And then in step 4, they came up with their list of activities, which is really their action plan to make this happen, to achieve their goal. So here's what TURF did. They developed an educational packet. They collected organizational and individual endorsements. They did media advocacy. They engaged key stakeholders. They secured decision makers. And they continue to develop their policy. So here's a little more detail on step 4. They developed their educational packet, which is this document, which is on our website, and it gives the background information. It talks about their research. It talks about their startling findings and statistics. There's pictures of the youth advocates in this document, and it explains the outcome that they're looking for, the policy campaign. They did a lot of presentations throughout San Francisco, and they were able to gather over 900 endorsements from commissions and coalitions, health and policy organizations, community-based organizations, and many individuals, including researchers. They did a lot of media advocacy. They were on the radio, in print media, and also on television. And here you can see them meeting with Supervisor Eric Marr, who agreed to sponsor their policy and introduce it to our Board of Supervisors. And then finally, very important on their list of activities, they engaged a key stakeholder, the Arab American Grocers Association, and met many times with the AAGA. So in San Francisco, most of the corner store owners are actually small, family-run independent members of this group. And you can see in the document that's on the left the list of suggestions by the AAGA to reduce the number of tobacco permits, as well as the list from the community leaders and the Department of Public Health. As they met over time, over about 4 to 6 months, these were agreed upon and became the final formula to reduce tobacco permit density in San Francisco. And that was presented to the full Board of Supervisors in December of 2014 and passed unanimously. So here's a picture of the youth emerging community leaders, the project coordinator, and the supervisor, as well as a member of the Arab American Grocers Association who testified in support. And here's the legislation. So it's Ordinance 19H, and it adds density, proximity, and sales establishment limitations for the granting of new tobacco sale permits. So they were almost done, but there's still a step 5 in the process. And that's where the group spends a couple of months working with different city agencies and making sure that the policy that was achieved is maintained and enforced. So throughout the CAM process, the group also met with our environmental health branch, those are our health inspectors, to identify how they would track and enforce this policy. So for example, environmental health had to make sure that no new stores can get a permit to sell tobacco in a supervisorial district that already had 45 permits. And you can see that they've achieved their outcome, or are achieving their outcome. Essentially, you can see that since early 2015, since this went into effect and over the last 2 years, almost 100 permits have gone away. That's about 10% of the total permits, with the highest reduction of tobacco permits in the districts that had the highest concentration. So what this really means is that the TURF team and San Francisco in general have moved us towards social justice and equity, that youth and people in low-income neighborhoods are now less inundated with tobacco marketing and access. So that's a quick overview of the 5 steps, and now I'm going to turn this over back to Derek, who's going to do another poll. Thank you.
All right, thank you, Susanna, for walking us through the CAM 5-step process, and thank you for illustrating, I think, with a really helpful story from the Youth Leadership Institute. You heard earlier from some staff as well as a youth member from that group about the great work that youth-led agencies can do to change the health of our community. So next up, we'd like to do a poll to test your knowledge and retention here to see if you can remember the 5 steps of CAM. So the next question we're launching is, which step would this be if a group of youth conduct a focus group with their peers about why they don't like to walk or bike to school? We'll launch the poll now, and we'll give you maybe 20, 30 seconds to answer that question. All right, just a couple more seconds to get your poll vote in. It looks like, wow, much of it, it's like we picked an amazing audience. We have lots and lots of answers for step 2. That's correct, designing and conducting the diagnosis process. All right, you perfected that. Let's try a second poll, another step. All right, this question is a different step. If a group of community leaders meet with the Department of Planning to talk about how 90% of residents support the idea of zoning areas for urban agriculture and community gardens to promote health and healthy eating, which step in the 5-step CAM process is that? All right, we're closing up the poll here. Yeah, it looks like folks had, I see what happened here. We had some votes, most votes for step 4, selecting the action and taking an activity an approach. So speaking of the Department of Planning was probably an activity that would lead them toward their goal of encouraging zoning areas for urban agriculture. And embedded in this kind of tricky question is the step 3 analysis. So they're kind of sharing back the analysis they've done previously. So this is an example of step 4, but there's elements to step 4 as well as step 3. All right, you're very sharp. We appreciate it. It's like you've all done this before. We're very thankful for that. Next up, Allie will address sort of the nuts and bolts of CAM, how a health department like ours can support community building and systems change through the CAM model.
Great, thank you, Derek. Now that you know about the 5-step process for the community action model, I want to tell you about how the San Francisco Department of Public Health Tobacco-Free Project implements the CAM by sharing the program structures and roles. There are 3 distinct partners that work together to implement the CAM. First, our Tobacco-Free Project, then our community-based organizations, and of course, our emerging community leaders. Just a reminder, our emerging community leaders are the ones who drive and implement the 5 steps of the CAM, and the community organization and the Tobacco-Free Project provide guidance to do so. I'm going to walk through the next slides to tell you about each partner's role in detail. So the first is the Tobacco-Free Project. We are the funders, the trainers, and the conveners. So our first role is to fund. We fund about 4 to 6 community organizations for over 2 years to implement the CAM model. In the past, we funded youth development organizations, community health boards, other nonprofits in San Francisco that represent different neighborhoods, ethnic groups, and other identity groups. Second role is to train. This is my favorite. Throughout all 5 steps of the CAM process, we conduct trainings for both emerging community leaders and community organization project coordinators. And since we aren't the experts on everything, we invite outside trainers to conduct trainings on media advocacy, legislative visits, and conducting community research. And lastly, the Tobacco-Free Project convenes monthly meetings with all of our CAM organization project staff to foster collaborative learning and partnerships. Many of our CAM organizations learn from each other's strengths. So for example, the YLI staff have provided support to other organizations on youth curriculum development. We also convene all organizations and emerging community leaders for celebrations and events that highlight the work that they've done. The second group is our community organizations and their project coordinator staff. Their main role is, one of their roles is to recruit and maintain 6 to 8 community leaders. We ask that CBOs provide a stipend to all their CAM leaders to honor their time and their work. Many of our organizations consider the CAM program an internship program. Secondly, the community-based organizations train and support their leaders either through weekly or bi-weekly meetings. CBO staff develop curriculum that support leadership and other professional development skills for their team. They may also provide other supportive services for the community leaders. So for example, one of our youth organizations provide case management to their CAM leaders because many of them are system-involved youth. Lastly, they provide guidance for their team to ensure that they complete all 5 steps of the CAM and complete program deliverables and reports to the health department. The last partner is our emerging community leaders. Our emerging community leaders engage and receive training and support from the Tobacco-Free Project and their organizations so that they can implement the steps of the CAM, from conducting research in step 2 to educating key stakeholders and decision makers in step 4, so that they can achieve their policy, system, and environmental level change. In our last CAM cycle, over 30 youth and young adults from San Francisco acquired skills to become change makers in our community. They're all working on achieving their policy, system, environmental level change right now. And so we've been doing the community action model for about 20 years. And I say we're pretty successful. We funded 63 projects that have completed 41 actions over 10 cycles. And we hope that more organizations and public health departments can use this model to train and equip emerging community leaders to impact health. So you can visit our website at sftobacco-free.org/action/case studies to read about other CAM projects. Aside from this webinar, we share 2 resources that you can download on the right side of your go-to webinar interface. The first is our hot off the press community action model case study that compiles our learnings from the last few years and testimonials from past community leaders and organizations. The second is a journal article that describes the CAM model that was published in the American Journal of Public Health in 2009. You can also find these on our website. So now that you've been hearing us talk to you for the last 40 minutes or so, we wanted to move on to a question and answer session. Just a reminder, Susanna Hennessy-Lavery, Anastasia and Estelle from YLI and Erica, and Derek and myself are available to answer your questions. So we're going to open up this time for Q&A. Feel free to raise your hand if you have a question, and Marina will unmute you and you can ask your question.
All right, everybody. Well, thank you so much for that very informative presentation, you guys. We have a few questions that came in, and I think maybe the YLI team could answer them. We have a few folks wondering how you recruited the emerging leaders, as well as a little more about how you worked with them to retain them in the program.
Hi, thanks, Marina. This is Anastasia. So in terms of, so to repeat the question, the first part was about how we recruited, and the second part was about how we retained. Is that okay? Great. So in terms of recruitment, and Edgar, also feel free to jump in. In terms of recruitment, initially, a lot of the recruitment that we did as a program was through SF State and through the Metro Health Program, in addition to sort of reaching out to other community organizations and the network that YLI sort of has in the San Francisco community. Edgar, I don't know if you want to add anything.
Yeah, I can just add that our advocates are transitional age youth, so most of the bracket of youth that we have engaged over the past 2 years are 18 to 21, and I think most of them are about the sophomore or junior level as we kind of enter the secondary year of the CAM campaign. So definitely partnering with school sites, different campuses, administration, whether it was City College of San Francisco or SF State, that's been a huge focal point. And then as far as how we've retained youth, I can speak to that on a kind of technical level. And Estelle is here, so she can kind of talk about why she stayed involved. But I think in partnership with a lot of the community-based organizations in San Francisco, we're very driven by social justice values. We're very driven by centering the leadership of those most impacted by health equity issues and disparities. So I think YLI is very much in alignment with the Department of Public Health, in that the young people stay not only because of the program, but because they feel like they can bring their whole selves here. Our staff are also reflective of communities most impacted as well, and so I feel like overall this is a holistic space that we're talking, learning, and challenging systemic issues together. And so that's a little bit of why I would say that we actually have successfully retained, I would say, about 90% of our cohort over 2 years. And we all know how busy college-age students are with jobs and internships and families, so we're really proud of that, and we're really happy to not just formally engage you for 2 years, but to watch them grow for years to come. And so we know those partnerships are going to thrive. And I'll pass it to Itzel to talk a little bit about why she stayed on.
Yeah, personally, why I stayed on with YLI for 2 years is because, like Erika mentioned, it is a holistic place, and every time that me and my peers come here, we're always heard on several different levels, and we're not only talking about the campaign itself, but also external factors that are like affecting our lives, and also just things that are going on in the world. And it's an educational place as well as a place to just relax and kind of just enjoy each other's company. But yeah, I would say that learning so much about my community and the ways that it has affected me directly and indirectly has kept me within YLI.
Great, thank you so much for sharing. Ali or Erika, do you think you can mention how much were the stipends on average for the advocates or for the emerging leaders?
So this is Anastasia. The stipends for the CAM advocates are $100 a month.
For our specific organization. Right. I think other programs might break it up according to, like, obviously everyone's going to manage their budget differently, so I can't speak to the other funded projects, but they might have done hourly according to their budget lines and all that. But for YLI, yeah, like Anastasia said, $100 a month.
Great, thank you so much, guys. We have one question. Hold on one second. There's a few of you guys that have questions, and these are more for Derek and Ali. If you can speak about for our partners at the state level or at other departments of public health, are we able to use this model instead of the Midwest strategy model for policy objectives for our state-funded work?
That's a great question. We actually, in all of our work, we encourage the use of a Midwest Academy strategy chart just as a part of it. It's one of the activities, right? So if folks are looking at step 4 and they're in their action phase, they're choosing what is their action, what is their big sort of policy system environment goal. Usually sitting down and thinking about who are your allies, who are your potential opponents is a really smart activity as part of that. So definitely we integrate that if someone's looking at a policy system environmental goal, which is really the hope of the community action model. Great question.
Great, thanks, Derek. What about the next question? What work does the health department do to prepare organizations and new organizations that haven't done any CAM work for applying for funding under the CAM framework?
Well, this is Susanna, and that's a great question as well. And I'm thinking back to more than a decade ago when we started doing this work, and we set criteria in our RFPs that went out, and we're specifically looking for organizations that had either a history of or an interest in what we call the policy system or environmental change approach. So they could be a service provider, but they had already done some kind of look at sort of the larger picture. So for example, one of the first groups that we funded was the Chinese Progressive Association that had worked in Chinatown to get recycling there. It was the only neighborhood in San Francisco that didn't have recycling, which has really at the time had nothing to do with tobacco, but obviously they understood the need for organizing for equity, those kind of issues. We worked with housing rights groups, homeless, people working around homeless issues and single room occupancy hotels. promotora programs as well as food advocates. And they weren't always, they've not always been youth who are the emerging community leaders. They're sometimes adults or people from those communities who are paid in a variety of ways. And one of the first things we did is we took a very complicated, probably, I want to say 30-page application for the proposals, and we simplified it greatly, and so that it was very clear how to apply for the funds, and so that we were able to reach out to many different communities in San Francisco that may not have grant writers and things like that. So, and those are available, and we continue to, I think, improve upon this tool and make it easier and easier, because we don't want that to be a barrier. So great question. Thank you.
Allie, and we have a next round of CAM coming up. Can you speak more about what we're doing right now to help new organizations apply for our funding?
Sure, that's a great question. We do have a new round of funding coming out, and there's a request for proposal on our website. Our website link will be at the end of this presentation, and you will be able to find the RFP there. There are a lot of ways that organizations can, I guess, prepare themselves. One is this webinar, so you hopped on, so I'm thankful for that. And the other thing is we have an info session on March 16th from 1 to 2 here in the health department, and that information is also on the website, and that's where we are going to be answering questions about the RFP. I hope that answers your question. If not, you can follow up.
Great, thanks, Allie. And then we have one more question. Do the CAM-funded projects have to have a tobacco control element in terms of what kind of actions that they choose, or are they able to choose different projects to work on?
Well, the CAM-funded projects that were funded through the Tobacco-Free Project, we do ask that they have a tobacco focus, but we encourage them to look at the issues of concern to the community, whether that be homelessness, food security, living in single-room occupancy, hotels. There's a variety of issues, housing, school-based issues, and encourage them and work with them to look at ways to link the tobacco issue to other issues of concern and equity and disparities in the community. And because we think that, of course, for this project to work, it actually has to resonate with the issues that the community is experiencing. And so we work very hardly with them to do that.
Yeah, there's a lot to be said about, there's not a specific type of agency. As Susanna said, that we're not looking for agencies for CAM necessarily that only have a tobacco focus or like a lung health or even a health focus. CAM is related to potential. So an agency that has a lot of community connection and a lot of potential to grow. As Allie indicated, her favorite part is training, and the Tobacco-Free Project tries to provide a lot of scaffolding, framework, training to support projects so that they can develop young people, adults, emerging community leaders, as well as the agencies, so that they have that funding and they have support and they have a framework so they can make some movement through these steps, hopefully ultimately landing on at least an attempt at an action in addition to the great capacity building that happens throughout the process. And as Susanna pointed out, I think a couple of, I don't know if Susanna, can you mention a couple of the wide-ranging types of agencies that have been funded through, there's so many that
I mentioned the groups working with single-room occupancies around homelessness, the Mime Troupe, for those of you that have seen plays in the parks here in San Francisco. They were funded, they did a play throughout the parks and in the schools called Revenge Your Rat, and it was about the transnational tobacco companies. There was a group that was very concerned about, this is back in early 2000, about healthy food in low-income neighborhoods in the Bayview, and eventually this turned into the Tenderloin. And they were able to link tobacco to food, because at the time Philip Morris owned Kraft and Nabisco, and that is what led to this program now that's a citywide program that's in city departments. It's called Healthy Retail SF, that's trying to help the store owners stock healthy food in a way that benefits them while reducing the amount of tobacco and benefiting the health of the community. So it's really just, as Derek said, it's an opportunity to look for ways to think outside of the box with this work. There was, for example, even the whole, there was an issue around beaties, for those of you that remember, that started with an agency. This was a youth agency, and they came to us and said this is an issue of concern, and it became quite a large project. So, yeah.
Imported small cigars, yes. So if it's all right, since we're concluding, we want to be respectful of folks' time. We just want to make sure that you see our additional information. This is a photo of our website. We have lots and lots of resources about CAM on our website. The website is sftobaccofree.org, so San Francisco tobaccofree.org, sftobaccofree.org. If you click on the section called Actions, that's really where CAM lives, the Community Action Model, and it indicates generally what CAM is. There's information there about the current request for proposals for San Francisco-based organizations. There's information about CAM and kind of training materials. And additionally, we have many, many case studies there. So we've documented the path that community agencies, just like Youth Leadership Institute, undertook over time. And there's a pretty good documentation of individual specific programmatic topic areas, like working on tobacco density issues or working on healthy retail issues over time. So it's a great place to dig in a little deeper on a specific issue and to follow the path and the story of an individual agency that engaged in CAM. Additionally, we're always happy to collect emails. Feel free to reach out to us at chep.tfp@sfdph.org. Sorry, that's a lot of letters, but feel free to reach out to us, and you can reach out through the website as well. Finally, we just want to thank you very much for attending. This is one of our trainings, and the amazing CAM emerging community leaders that we are so lucky and fortunate to work with, who've really changed the world in their engagement in the community action model, in their partnership with the Department of Public Health. They're teaching us how to do better in our work, and they're really on the ground efforts to engage their community and make amazing change in health. We just ask at the end that you please don't forget to provide feedback via the survey. This is our first time doing a survey. We appreciate your patience with us. Doing a webinar. We appreciate your patience with us, and we would love your feedback as we're hoping to do more CAM training in coming years and creating a lot more support for agencies inside and outside of San Francisco. We thank you, and we hope you have a great day. We're concluding the webinar now.